This segment is sponsored by Children's Hospital of Richmond at VCU.
The doctor is in and you have questions. Dr. Jordan Noble is completing her training to become a pediatric cardiologist at Children's Hospital of Richmond at VCU. But her path has been a bit more personal than most. In honor of Heart Month, she's here to share her story and the heart care available for kids at Chore. Thank you so much for being here.
Thank you for having me.
You are completing your fellowship in pediatric cardiology. Tell us about what that is for folks who are not familiar with what the fellowship is.
Yes. So initially you do medical school and then you decide what type of residency you would like to pursue, which is just general training. So I did 3 years of pediatric training in residency, and now I'm a board certified pediatrician. 3 additional years of training to become a pediatric cardiologist, which is the fellowship level of training.
What inspired you to follow this path to be a pediatric heart doctor?
So at 3, I was diagnosed with congenital heart disease. And at that time, I had always told my parents I was going to be a baby heart doctor growing up. And whenever I was 20, I found out that it was time to have open heart surgery. And so after that, I really solidified that I was going to go into medicine. And in residency, I got to spend time with pediatric cardiologists and see what they do every day. And it really just told me that that's what I was supposed to do.
That was your calling. That's what you were going to make your career out.
It was, yes.
So what has your training entailed?
So for the first 4 years, you just do general medical training in medical school, which is pediatrics through adults. And then for residency, it's really focused just on all of the aspects of general pediatrics, from primary care to subspecialty care. After that is over, you do 3 years of general pediatric cardiology training. And if you want to further subspecialize within the field of pediatric cardiology, you can with additional fellowship. All of the heart care that we provide at Children's Hospital of Richmond has multiple different subspecialists involved. So we have interventional cardiology, which is a pediatric cardiologist who actually can do cardiac catheterizations. We have electrophysiology, which is a specialist who deals with abnormal heart rhythms. We have people who do non-invasive imaging with echocardiography, cardiac MRI, and CT scan. So there's a variety of different things that you can further subspecialize into.
So you are not just a physician, but you've personally been there. What would you tell parents who are just now receiving that diagnosis about a child with a congenital heart condition?
I would tell them that I recognize how scary this is and that they probably did not come to the appointment or the hospital visit prepared that they were going to receive this news, but that we are all a team and that it takes an entire village from them to us to make sure that we are taking the best care of their child possible, and that we have all the subspecialists and all the availability to do that at Children's Hospital of Richmond.
February, of course, is Heart Month, but why is it so important to talk about pediatric cardiology throughout the year?
Adult cardiology gets a lot of reputation within the news and in social media, and I recognize that acquired heart health is very important, but we have this entire population of patients who have congenital heart disease that no one really knows exist. And so I think it's really important to spread awareness and make sure that we're doing more research to get them the care that they need.
And that is what we are here to do here, give a voice to those children. Thank you so much for coming in today, Dr. Noble.
Thank you.
For more information, you can give them a call at this number, 804-828-2467, or you can visit the website chrichmond.org/heart. And stay with us. Virginia This Morning returns after the break.